Welcome to today's COVID-19 update. We're of course speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you very much for having me in the program.
Yes, sir. When we spoke the last time, the health teams were looking into cases at the prisons. I just wanted to ask you for a quick update on that.
Well, we have a few cases in the prisons. In New Amsterdam, we had a number of officers who tested positive, so they have been isolated. We had one person from the prisons itself who had tested positive, and that person is also in isolation. We have seen a number of cases at Timeri, and those prisoners have been in isolation. And I guess sometime during this week, we'll be able to discharge them because this was happening since last week. So they will be up there 10 days, and all the persons who we have been monitoring so far are asymptomatic.
Okay. All right. I have some specific questions from the other media houses. The Guyana Chronicle is asking, with the nearly 104,000 doses of the vaccine that will be allocated to Guyana through the COVAX facility, are there any plans to administer these to any other segments of the population aside from the health workers and the elderly with comorbidities?
Well, our deployment plan for vaccines, first of all, we want to give to the frontline workers. We had calculated that to be close to about 22,000 people. And the rest of the vaccines, so you have about 52,000 persons can be vaccinated with the vaccines that we're getting from COVAX. So the rest of the persons who would fit that category would then be the elderly and of course comorbidity. So we'll have more persons in those categories than at present with the vaccines that we're getting from COVAX. We are making other arrangements to be able to acquire vaccines, and therefore we should have enough vaccines to take care of the elderly and the persons with comorbidity. So we're working on those arrangements right now. They haven't been completed as yet, but we are very optimistic that we'll have additional vaccines to be able to cover those persons in those categories. When we completed health workers and the elderly and of course people with comorbidities, then we'll go to the next level, which is other persons in the population. But again, because the vaccines are not mandatory, there might be persons who would not want to take it, and therefore it frees up a vaccine for another person. My advice, however, is that persons who are offered the vaccine should take it because it would help them to minimize the infection and reduce chances of being hospitalized, because we know that these vaccines can help to prevent that from happening.
Okay, and of course this is from the first 3%. You still have a 17% that.
Well, we're actually going to get more than 3% in this case because we're now getting the 50 vaccines for 52,000 people, right? So we're getting more than the.
Yeah. Thank you for that mathematical lesson. We have a follow-up question though. The question they're asking, do we know which Chinese vaccine that Guyana will be receiving, and when will Guyana receive those vaccines?
Well, again, we're concluding those arrangements for that donation. The vaccine that we have been told that we will be getting, and this is vaccines that are being donated to a number of countries, is the Sinopharm vaccine. And it has efficacy of 79.34%. So it's from all the clinical trials, it's pretty good. And it has been given emergency use authorization in China, in a number of countries in the Middle East, and here in the region, I think they've been given emergency use authorization by Argentina and Brazil.
Okay. Yeah. Still with the Guyana Chronicle, it's a different topic, but as we're talking about their questions, they're asking with filaria, the MDA set for this month, is there any specific schedule the pill distributors are working with? And they're asking specifically, for example, if they're working concurrently or consecutively in the regions.
So we are scheduled to launch this program on the 12th of February, and we are looking at a small official launch at the Guyana on the 12th. Immediately after that, around the 14th or so, we'll officially kick off the rolling out of the program, and the program would start in regions 3 and 4, and it would go for about 2 weeks. We have enough people to literally go house to house and meet everybody and distribute pills. So we expect that this program would go on in these 2 regions for about 2 weeks. And then in early March, from the 1st of March, say to the 14th of March, we'll be looking at Region 5 and Region 10. Or Region 6 and 10 rather, 6 and 10. And then starting from the 8th of March, we'll then be looking at all the other regions. So we'll have teams going into all of those regions.
Okay, Minister, the follow-up question is on the filaria. They're asking if there's a specific deadline that we have to complete the entire exercise by.
Well, we did the mass administration before, about 2 years ago, and we are required within this interval of 2 years, having completed 2 years, to be able to do the second dose. And so we have identified that time period with PAHO, and that's why we are now rolling it out between February to March. But I want to again appeal to the public, because if we're successful at getting about 70% of our population taking these tablets, we would be able to eliminate filaria from Guyana. And this has been a problem that we've had for many, many years, have been affecting people, because we would have seen persons who, we call them Bigfoot, and those persons would have been suffering from filaria because their lymphatic system would have been invaded with the parasite. We can avoid all of this if we eliminate this disease from Guyana, and therefore this is our chance to do so. And I do hope that persons cooperate with the persons who would be distributing the pills, and take those tablets so that we can really eliminate filaria from Guyana once and for all.
All right. If I can ask you, if this time would have elapsed, what would have happened to the entire program?
If you go beyond a certain time period, then we'll have to start all over again, because that first dose medication would not be as effective, and therefore when you do the second dose, it's not going to have the same impact. So you have to administer within a time period for you to get that desired effect that we are looking for. So if we miss now, then we'll have to restart back the program as if we were starting anew. And we already did quite a lot of work with administering that first dose. So now we have to do the second dose and complete the process. So we have done well so far, because with the first dose we have achieved the targets that we have set. And I'm very confident with the cooperation of the general public that we can get to that second dose target as well and be able to be declared filaria free.
Okay, Minister, thank you so much. We have a question from NCN, and they're asking, in regional news, the vaccines delivery schedule was announced for countries participating in COVAX, and they just wanted you to comment on that.
Well, as you know, we are participating in COVAX. We are one of the countries that are part of a subgroup of COVAX called the COVAX Advanced Market Commitment, or COVAX AMC. And we, through that mechanism, Guyana would be getting vaccines for 20% of its population. COVAX, they have a basket of vaccines that they're working with, manufacturers such as AstraZeneca, Pfizer, and there are some other vaccines that are now completing the phase 3 trials. So in this instance, they've been able to work with AstraZeneca, and more particularly the Serum Institute of India, who is manufacturing the vaccine. And Serum Institute has made available to COVAX 150 million vaccines in the first quarter of this year. And because those vaccines are now becoming available, they have now started assigning vaccines to different countries in the region. There are 10 Caribbean countries who qualify as COVAX AMC, so all of those countries in the Caribbean would be receiving vaccines free of cost. And there are other countries from the region that who would have paid for their vaccines, so they would also be receiving a quota of the vaccines that they've paid for. So we are very pleased that COVAX have been able to make these arrangements, and that we'll be able to get them within the first quarter. Now, one of the challenges that they have identified is that the AstraZeneca vaccine is currently with the WHO pending the emergency use listing. They expect that they would be able to get that listing by mid of February. So once they have received that listing, then they would roll out the distribution. So the vaccines are already there. It's just a matter of ensuring that they get the listing. This vaccine, however, has been given emergency use authorization from the UK. It has also been given emergency use authorization from the European Union and from India, and there are many other countries where the vaccine is being used, where those countries have granted emergency use authorization.
Today we're joined by a member of the private media, Ms. Tamika Rodney. She's from HGP Nightly News. She has a few questions for Minister Anthony.
All right, Dr. Anthony, thank you so much, you guys, for having me this morning. My questions are based on the AstraZeneca vaccine that we will soon be delivered into Guyana. Can you say, I mean, there is Pfizer, there are other vaccine options available, but Guyana was afforded the vaccine that has the lowest efficacy rate when compared to the others. Can you say why we weren't given the other options, Pfizer, Moderna, with higher efficacy levels?
Well, COVAX, the facility that we're currently working with, as I said, they have a portfolio of vaccines, which include Pfizer's vaccine. And they have been working with countries to see which countries are ready for the Pfizer vaccine. And they have, in fact, given some doses of the Pfizer vaccine to those countries. They don't have a huge contract with Pfizer because only recently they probably would have concluded an arrangement for 40 million doses. So I think a lot of those vaccines that they've acquired from Pfizer are going to those persons probably who have paid for the vaccines. So that's one. In terms of the actual vaccine from AstraZeneca, you mentioned that it has the lowest efficacy. That's not true. You have other vaccines that have been in clinical trials that probably are lower than AstraZeneca. But AstraZeneca, when they did 2 full doses, they were able to see that the vaccine was about 66% efficacious. But when they do a half dose and then a full dose, it went up to about 90%. So these dosing regimens can make a difference, and that is why in the literature they're saying that these vaccines, the efficacy can range from the 66 or 62% to as much as 90%, depending on the dosing that you're using. And that's why it has gone through a number of these stringent regulatory authorities, like in the UK and in the EU, and they are going to determine, and they have determined, that this vaccine is safe for use and it can be used in their population. And in fact, I'm sure you have been following the news. Last week you had quite a lot of controversy in the European Union because their thing is not so much the vaccine. They wanted to know why they're not getting more vaccines, more AstraZeneca vaccines. So it is a safe vaccine, and we are going to be using that. As I said, we're also working with a number of other entities to be able to acquire additional vaccines, and we have also prepared our cold chain to deal with the Pfizer vaccine and Moderna vaccine once we are able to get it.
Can you say if it's guaranteed that we will likely get a chance to have the Pfizer Moderna?
I can't say that right now. What I can tell you is what we have currently have with COVAX, and that is we are getting the AstraZeneca vaccine. So I can't tell you that we are going to get Pfizer or Moderna or whatever it is, because the allocation from COVAX, they would do the allocation. We have no influence on the allocation. They have asked us for documentation, which we have provided, but ultimately they make their decisions, and this is what is available to the countries.
Earlier you mentioned that some countries would have made a down payment for the vaccines. Can you say if Guyana made any down payment?
Not through COVAX, because through COVAX, our arrangement is that we fall as a COVAX AMC country, and therefore we are going to get those vaccines free of cost.
And you said the efficacy rate for the AstraZeneca is about 90?
It ranges. Right. So it's from 62%, I think, 62% to 90%. And that depends on how you, the doses that you're giving. So in the clinical trials, when they did 2 full doses, they found that it's coming out at 62%. When they did a half dose and a full dose, that is taking you up to 90%. So these are the results from the clinical trials. So a lot of the literature is now reporting it as a range rather than a fixed number.
Understood. From the 104,000 doses, can you say if it will cater for persons who have to receive the second doses for the vaccine?
Oh, yes.
And that will be done within what time span?
Well, it's I think it's 21 days that between the first and the second dose. So we'll have to administer. So with the 104, we'll cater for 52,000 people, and so we'll do the first dose, roll out the first dose, and then come back and have to do the second dose.
There are some concerns about this AstraZeneca vaccine. I mean, Germany is one of the countries that stopped administering this type of vaccine to persons above 65 because they found that it's not as effective with those persons. I'm not sure if Guyana will be doing the same thing, or it will be administered to, well, of course it'll be priority the elderly population, so definitely it'll be administered to persons over 65 here.
The Germans made a recommendation to the European regulatory authority, and that is that they wanted it not to be administered for persons 65 and over, because they believed that they did not have enough personnel when this vaccine was tested in the trials, that not enough persons above 65 was in the trial. So based on that, that's why they were asking for the European Regulatory Authority probably to restrict the use. The European Regulatory Authority, having considered this request from Germany, did not grant it. And they have sat and analyzed all the scientific data and has granted use of the AstraZeneca vaccine for the entire range of population, excepting for children. So it is being used for adults. And so when we receive the vaccine, we'll follow the guidance that is currently available, and which would include from the European Union, from the UK, and the WHO, as I said, is expected to grant emergency use listing by mid-February, and they would also put stipulations, if there are any, that should be abided by. So we'll follow those guidance.
What monitoring mechanisms will be in place for persons who receive the vaccine from the different public health care workers, public and private healthcare workers?
When we administer the vaccine, there's a process. So the health worker who would be administering the vaccine would talk to the person about its possible side effects, what to expect, because with people getting vaccines, at the site of the vaccine, you would probably get a little pain, a little bit of inflammation, and things like that. Some people might get a little bit of fever. So what to be expected? So persons would be told that. And then if you have any of those reactions and you want to report it, there will be a form, there will be a way of reporting it, and that would be told to you as well. These vaccines, we're not expecting that they'll have much adverse reactions, but nevertheless, we have set up a team that would be doing the monitoring for adverse reactions. And again, we have devised a system by which these would be reported. So once we get those reports, if any, we'll then be able to take actions. With the Pfizer vaccine, for example, and Moderna vaccine, there have been reports of adverse reactions such as anaphylactic shock and Bell's palsy. But again, those things are taken care of in the way that the vaccines are being administered, because an anaphylactic shock would occur shortly after a vaccine. And while there have been very few cases, it's really a rare event that has happened with some people. But to know, what you do is after you administer the vaccine, these are the Pfizer and Moderna vaccine, people are asked to stay in the vaccination site for about 30 minutes so that they can be observed. And then after that observation, then they're allowed to go. So if there's any anaphylactic reaction, it would develop within this time period. So that's one way of how you deal with that. And of course, if such a reaction develops, then there's a way of how to treat with that.
All right. You did mention a system, but what I'm trying to understand is what does that system entails? Are the healthcare workers are going to make a call to make checks on these persons, or?
No, it would be a system where people, if they develop, well, first of all, the immediate ones, the adverse reactions, like the one that I mentioned, which is not, by the way, that does not occur with the AstraZeneca vaccine. So the immediate ones, if you have any immediate reaction, let's say, that would be observed by the people who are administering it, right? The vaccine, because they'll be there, it would be seen, it can be dealt with right away. But when you go home, there's something called reactogenic reactions, if you like. And that is because when you get a vaccine, at the site of the vaccine, you'll get irritation, fever, and things like that. Those are common things that happens with vaccine. So after a day or two, it's okay, right? But people might choose to report those things. And we'll set up a system whereby they can call in, they can report it. If they want to come back to the site to give information, they can do so. But there's a specific form that would have to be filled out. So all of that forms and everything else have been devised. And the healthcare workers who are part of this immunization program have been trained on how to collect this type of information and to monitor for any adverse reactions that people might report. And then that comes to a group of people who will be overseeing the process. So all of this is collected on a daily basis. It's going to be analyzed so we can pick up if there's any trend.
In essence of time, could we have like one more question?
Sure, no problem. I'd like to revisit a claim made by Eureka Medical Laboratory. In an interview with me earlier in January, they had stated that they found some suspected cases of one of the new COVID-19 variants, but of course they weren't able to confirm that that was the case because they can't do the gene assessment. Yeah. So I understand that some samples were sent to CARFA for that gene sequencing procedure to be done, and they're expected this week, or I'm not sure if you can.
So what's the question? When the samples are coming back? Yeah. So we have had this thing in the press that was going on that variants of COVID was identified here. It's very difficult to identify those variants because, first of all, the PCR testing that we're doing does not differentiate between one variant or another. People can, there's one specific test that we have seen maybe that if it doesn't react in a certain way, then perhaps you can try to make an inference. But that does not tell you whether you have a B117 variant or a P1 variant or anything of the sort. So when that claim was made, the ministry wrote to Eureka and asked for that information. And they didn't provide any because, they made a claim, but they couldn't provide any evidence of such a claim. And so we didn't have anything to go by. We have since made arrangements with CARFA to be able to send samples that we suspect might be, if we think that these samples require gene sequencing, that we can send them to CARFA. Last week we sent 10 samples, and we are awaiting the results from CARFA. They might take between 2 to 3 weeks to be able to do them because it's a laborious process, and so we haven't gotten back those results as yet. But we'll see when we get back the results whether there's any variant or it's the usual coronavirus that we are dealing with. So we'll know that when we get back those results. But we have worked out a system where every month we will be sending to CARFA at least 10 samples. And if there's anything that we can pick up, perhaps these samples would tell us that. But variants, you need to do the whole gene sequencing before you can be able to conclusively say that you have a variant here or not.
How are these samples selected to be sent to CARFA? Because you mentioned that you're sending samples that you suspect might have the new COVID-19 strain. So are they randomly selected, or is there something that the labs look for or something of that sort?
The laboratory people are the ones who made that decision, and I guess they had a criteria that they were working with. And we did reach out to Eureka and ask them to provide us the samples that they thought they had found a variant on. So we asked them for the sample. And those things have been included in the set that we have sent to CARFA.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. We were also joined by a member of the private media. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.